This was a study that we have. It's an effort out of Molecular Epidemiology Resource Cohort of Mayo Clinic. And it's a observational study of all the patients, adult patients who were diagnosed of lymphoma between 2002 and 2014, and they were followed up. So we had excluded patients who had diagnosis of second malignancies within 90 days. And of the lymphoma diagnosis. And then we observed the patients over the next 10, 15 years. And we did observe that, and then we did compare incidence of second primary malignancy to cohort of Iowa Seer general population who did not have lymphoma. So we, at about 10 years, we observed cumulative incidence of about 10-12% in any second primary malignancy in lymphoma survivors. It was the likelihood of developing second malignancy in lymphoma survivors were lower than general population. We observed about 0.07% of patients developing second therapy-related myeloid neoplasm at about 2 years, and then when the incidence increased to up to 0.1% at like 10 years. So it's like very minority of patients develop therapy-related myeloid neoplasm at 10 years. But this population was minority, but when we compared to general population, lymphoma survivors had higher likelihood of developing therapy-related myeloid neoplasm. So it is still highly more unlikely for a lymphoma survivor to develop therapy-related myeloid neoplasm than general population, although it was the most infrequent malignancy in our cohort. Solid tumors were more common than therapy-related myeloid neoplasms, but the likelihood of developing solid tumors was lower when compared to general population. So overall, overall, when we compared with the factors associated with development of second malignancies, receipt of chemotherapy and alkylating agents were mainly associated with a higher likelihood of developing second cancers, in addition to increasing age.